And a new study that says abdominal fat may be a better predictor of your heart disease risk than your BMI or body mass index alone. BMI is the number commonly used to assess if you're at a healthy weight, but this study says it could be missing key information. And our chief medical correspondent, Dr. Tara Narula, is here to break it all down. You're a cardiologist. First of all, what do you make of this, and what have we learned from this study?
I'm really glad we're talking about this because traditionally we talk so much about body mass index. In my office, every day we take blood pressure, heart rate, temperature, and BMI, which is your height-weight ratio, and we tell the patients about it, and it informs them of their cardiovascular risk. However, the new research really suggests that that's just not enough. Body mass index doesn't tell us about fat versus lean mass. It doesn't tell us about the distribution of the fat. So what might be a better marker, Whit, is central adiposity, or fat around the belly area. We know that that seems to tell us much more about cardiovascular risk and be additive to body mass index. In fact, that visceral fat, the fat around your organs as opposed to the sub-Q fat under your skin, we know is really a big problem in terms of causing metabolic dysregulation, inflammation, increasing your blood sugar, blood pressure, and cholesterol. So in this study, researchers looked at about 260,000 individuals. They looked at 9 different cardiovascular outcomes, things like heart attack, stroke, and they followed them for 20 years. They measured their BMI, but they also measured their waist circumference and their waist to hip ratio, those markers of central fat. And so they found that those markers of central fat really added to risk classification, whereas the body mass index alone misclassified people. So to give you an example, in the study, if someone had a normal body mass index, about 18% of those actually had a high waist to hip ratio, which meant that over time, they were at increased risk for those cardiovascular outcomes, 9 of those. On the other hand, those individuals who had obesity, actually 45% had a low waist to hip ratio, which meant that they probably were not as at high risk as you would expect. So it tells us we really should be adding this into how we inform patients in the office using those waist markers.
Yeah, it sounds like 1 in 5 of the people were at a higher risk than the BMI would have indicated. And you can actually do something at home to figure out if you fall into this group.
You can measure your own waist circumference and waist to hip ratio. So you basically want to do it without clothes on, take a flexible tape measure, measure at the highest point of your hip bone around your waist, that's your waist measurement, and then for your hips, around the widest part of your hips. And you can obviously divide those and get your ratio. Your waist circumference, if it's elevated, we say it's more than 35 inches for women, more than 40 inches for men. For that waist to hip ratio in this study, it was more than 0.85 for women and more than 0.9 for men.
Okay, so you take out your tape measure, you actually do this yourself.
Yes.
If your numbers are high, what do you recommend?
You should definitely talk to your doctor about that. Also about your other cardiovascular risk factors. We can't say enough, leading cause of death. So know your other numbers, talk about how to get screened for heart disease. But really important, actually, more for the medical practice, that we start putting this into how we assess patients routinely. It's just not common right now.
And it's also a great tool for people at home. They can keep track of it themselves without having to do one of those scans. Yeah.
Exactly.
Thank you, doctor. We appreciate it as always.